Some people come in and they have a small fracture, and some people come in and they have a really big fracture. And by big fracture, I mean the bone is just broken into multiple pieces. If you hear the word like comminuted, I had to learn how to say that word too. Comminuted, it means it's broken up into multiple pieces. And so when things are broken up into multiple pieces, if they're big pieces, the doctor can fix that a little bit better. But when it's comminuted and then it's a bunch of small pieces, it makes it a little bit harder. I always describe it as like Humpty Dumpty fell off the Great Wall and all the king's men, and they're trying to put Humpty Dumpty back together again. Well, it's kind of like that. So if you have a little break, it's a little bit easier to put you back together. When you have a big break, it makes it a little bit more challenging. So pay attention and tell your therapist when you're having problems with your thumb. Like my patient specifically is having some thumb pain, not there so much, but it's right here at this base. Your thumb comprises of 3 joints, the little one, the middle one, and the big one, right? So he's having a lot of thumb pain, but he had a little bit of thumb pain from before that I just found out about. So, but thumb pain because you're trying to move so much. And a lot of times, think about gravity. Gravity is pulling you down. So your wrist likes to sit here versus here. And so that can kind of twist and torque at your wrist too. So pay attention to what's going on with your hands. I don't want to wait until the swelling is gone to address that problem. I don't want to wait until the bone is healed to address and fix that problem. Nerve problems need to be addressed fast and early on if you can help it, because nerve problems will cause you to have a slower progress in your recovery. So, hope that helps you. You don't want those 2 nerves affecting how your fingers feel, because it affects how your hand and wrist move.